Welcome back. Doctors at Eisenhower Medical Center say they are definitely seeing a flattening of the coronavirus curve, but we should still not let down our guard. Today, I spoke with the hospital's chief medical officer, Dr. Alan Williamson. Dr. Williamson, thank you so much for joining us.
Thank you, Peter.
How are things at Eisenhower right now? Better or worse than you had expected?
Thankfully, things are better than we had planned for. We really planned for the worst and hope for the best. And fortunately, because of all of the social distancing, wearing the masks, staying at home and staying safe that the public has been practicing, we are not seeing the worst of what we had feared could have happened. So fortunately, right now, we have been able to keep up with capacity. It's not been an undue stress to the system. So we're very thankful to the community for everything they have done to really make that happen for us.
And can you tell us how many patients the hospital is currently treating for coronavirus?
We have 16 patients in the hospital today with coronavirus. Fortunately, we're seeing fewer patients in our intensive care unit. I believe we only have 4 patients in the intensive care unit today. So definitely seeing a flattening of the curve. We've actually been quite steady in the number of cases we've seen for about the last 10 days. So hopefully we've seen the worst of this. It is not over, however. We will continue to see patients. We see a similar number of patients coming in every day. So it's not that the number of cases have completely gone away. It's just that fortunately it is staying relatively flat. So we're able to keep up with the number of patients that we need to see and take care of.
That is fortunate. Have any staff or medical workers tested positive?
We are members of the community like everyone else. So we have seen a few members of the staff become infected with COVID-19. We have a screening process in place now for all of our employees so that we can try to catch anyone that might be showing symptoms of COVID-19 to help protect the rest of their coworkers and also the public to be sure that we're not a vehicle for spreading this disease as well.
From your perspective, Dr. Williamson, does it seem like the pandemic is getting under control here in the Coachella Valley?
I think that we do have it under control, but again, I just want to stress that does not mean we are through with this. The disease is still definitely out there. It is still infecting new patients. We're still seeing, unfortunately, occasional deaths. So I don't want people to let down their guard. What we really want to acknowledge is what we have been talking about all along, the social distancing, the staying at home is working. So we need to continue that course.
And is there any common trend in the patients that you've seen?
No, we've seen pretty much across the board. One of the interesting things is seeing a higher mortality rate among men than women. This is being seen nationally as well, and it's unclear exactly why that is. I don't think we saw as many patients as we feared we would, since we do have a patient population that is older and many of whom have some of the comorbid conditions that we worry about putting them at increased risk. But I think we also saw a lot of those same patients really taking our recommendations seriously and staying home, so they were out of the pool of patients to be exposed and potentially get the virus. So it's been a sort of a mixed bag, but I think we're seeing a really positive result, and we're very, very happy that we don't need to exercise those incredible surge plans that we had in place to manage a true catastrophe here in the valley.
That's good to hear. How is the hospital doing in terms of personal protective gear? Are there any shortages?
PPE continues to be a challenge for everyone around the country. Fortunately, we have a lot of innovative things that have been done here for us to be able to extend the use of the equipment that we have and source outside sources to be able to continue to get equipment as we need it. We still have the community stepping up and providing us with masks and gowns and so on. So we're thankful for all of the community's help to support us through that. At the moment, I think we're doing reasonably well. And hopefully, if we continue to see a trend of slow decrease in the number of cases that we're caring for, we'll be able to get through this.
Dr. Williamson, it was great to see you again. Thanks so much for joining us.
Thank you, Peter.